Thrombocytopenia is defined as a platelet count less than 100,000. This can be caused by decreased production or increased destruction of platelets. High risk for spontaneous bleeding occurs when the platelet count is less than 20,000. A normal platelet count is between 150,000 and 400,000. So thrombocytopenia means low platelet levels, essentially. Some signs and symptoms of thrombocytopenia could be petechiae, which are the little pinpoint hemorrhages that you might see on their skin. It looks like kind of like freckles. Bleeding, or they may have a headache if they have cerebral bleeding. Diagnostic tests that can be done. If they're bleeding, their hemoglobin and hematocrit will be decreased, so that'll show if they have active bleeding. These patients will show a decreased level of platelets, less than 100,000, and their PT and their APTT will be increased, meaning that it takes their blood a longer time to clot because they have decreased platelets. For medical management, these patients can get a platelet transfusion, and it's important to remember not to give these patients any IM injections or any medications that can increase their risk of bleeding, like NSAIDs. As for interventions, really initiating bleeding precautions, so padding the bed and bed corners, using a soft toothbrush, wearing proper shoes to prevent falls, avoiding clipping toenails or fingernails, avoiding contact sports, really avoiding anything that can cause them to bleed. Also using an electric razor instead of a razor with blades. And then monitoring the patient for signs and symptoms of bleeding.